Those are those answers where even if a lecturer was marking your paper angesema tu we huyu na alikuwa class. Hi guys, welcome to One Cafe. And today I have a very exciting discussion that we're going to discuss digital health among young people. And I hope the conversation will be great and you'll learn a thing or two. And our guests will also enjoy this discussion and I can't wait for you to know about them. Karibuni sana. Okay, so first we'll start with Michelle. Michelle is from SDI Kenya. Then after Michelle, we'll go to Eugene from Basic Needs, Basic Rights. Karibu, Michelle.
Thank you so much, Joy. Hi, guys. My name is Michelle Koyaro. I am an urban planner, currently supporting the research department within SDI Kenya. And basically, SDI Kenya, what we do is we support the community federation, in this case, Muungano wa Vijiji, with technical support. And whatever that has brought us here is that we support even the community members to enhance the mental health accessibility at the settlement level. So far, we have been able to train 90 of the community members to become mental health champions within their settlements. And out of the 90, we again went ahead to select 20 of them to become trainers of trainees. And they're currently supporting in terms of even establishing the climate resilient cafes within these settlements. One reason why we are looking at the climate resilient cafes is because we already know how climate change impacts the community members, and the informal settlements are the most vulnerable in this case. And we're looking at what are some of the platforms that the communities can use to just channel some of the stressors that they're facing. And these cafes are part of the the platforms that we have created, whereby we're also offering the peer-to-peer group counseling sessions. And yeah, that's basically what we do. Thank you so much.
When you say cafes, someone might think is they go somewhere and drink some kahawa. What do you mean by cafes?
Yeah, yes. Ultimate as a platform for community members to be able to just let it all out.
Okay.
So whatever stressors, whatever emotions that they just want to express. I know some people right now, they face quite a lot of drug addiction. They face issues of GBV, issues of sexual abuse, which are also now an aftermath of the climate change impacts. And we need to now discuss them. And I think this is now the time and even the platform that has been created for us to enable community members to fully discuss these issues.
All right, cool. That's a lot of work you're doing there with the community. Okay, over to you, Jay. Tell us a bit more what Basic Needs, Basic Rights does.
Yeah. Eugene Onike, basically a communications advocacy specialist. Yeah, so basically I work with Basic Needs, Basic Rights Kenya. So for us, our core focus is to nurture communities that value the mental health and well-being. So for us, community can be anything. Community from the geographical aspect of it, or community from even an institutional setting. So a school for us is a community. A community in the sense of it, when you go to, let's say, a certain Mukuru, Mathare, that's a community. If you go to Kilifi, wherever, that's a community. So anywhere where people live together and work together, for us, that's a community. Okay. So it's important for us to foster communities that value the mental health and well-being. So the same way you cater for your physical health, when you're sick, you go to hospital. It's the same way you're supposed to cater for your mental health.
Yeah.
And in this case, mental health doesn't mean you have to go to hospital when you're sick.
Yeah.
There are things you can actually improve by just improving your environment or understanding how your environment affects your mental health. So for instance, in relation to this particular program, Zero to Resilience, a change in temperature, a change in weather can actually affect your mental health.
Yeah.
It rains too much, there are floods. There's a way you respond to those floods.
Yeah.
It affects your mental health. And so your ability to be prepared for stressors that will come to your life. That's what, as an organization, we try to work with communities for them to understand that you can actually prepare yourself for stressors. So the better prepared you are, the more well prepared your mental health will be in the face of stressors.
Yeah.
So mental health as communities, typically when you say mental health, people already jump to mental illness.
Institutionalization, yes.
Institutionalization, the illness part of it.
Yeah,
But
yeah.
mental health is just your ability to cope with
Whatever
day-to-day
stressors.
stressors. Because life will always have stress.
That's
No
true.
one can tell you they're living a stress-free life.
Yeah.
Now it becomes a mental illness if you can't cope with those
Stressors.
stresses. Yes. So as an organization, we try to prepare communities as much as possible, both in urban and rural settings, to be able to basically just build their mental wellness.
Wow.
Yeah.
Hey, you have done a lot of well, you've communicated that very well as a communication expert. That's good to know. And just looking at also now the aspect where one-to-one comes in, even in relation to the race to resilience. And looking at even our partnership, because now we have been working together for a couple of months now. And we were like the missing piece of your intervention in relation to just finding somewhere where now the guys who are in probably a state where they need mental health support, they can, reach out immediately. I'm just wondering, how do you think that partnership has been so far? Start with Michelle. How has it been for you?
I think I can even just give an example. Just before even the partnership started, we realized that there was a gap.
Okay.
And the gap was that there's quite a lot of mental health stigma within these settlements. And majority of the community or the dwellers, the slum dwellers, they wouldn't want to go to a health facility when they want to seek any mental health support.
Yeah.
And therefore, we were looking at what are some of the ways in which we can support these community members to still seek support, but also ensuring that they are safe and also ensuring that whatever support that they're seeking is also private to them and them alone.
That's true.
And the moment that this partnership came, even through basic needs, it was really grateful because you'll find that these community members can now even call. They can text the toll line.
Yeah.
They can easily access that digital health service that you're looking at. And they don't have to physically go to a health facility to seek support. So that means ni siri yake tu mwenyewe. Yeye ndo anajua ni nini anatafuta na yeye ndo anajua ni support gani anataka.
Yeah.
And so far, even just having debrief sessions with the community members, you'll find how majority of them are actually sort of saying how much, even the partnership, the one-to-one, the toll number has supported them in ways that even as we can't imagine. Because anytime they know that they can always call, they know they can always text, and they know they'll be able to be given feedback on the same.
That's true. Oh, good to hear that. And good to even know that you're able to even have feedback sessions from the community members. That's wonderful. What about you, Jane? What would you say?
Yeah, I'll just add on to what Michelle has said so that I don't repeat things. So I think one-to-one was actually an ideal partner because the additional services that are offered beyond just mental health. Because typically mental health issues are not usually, don't happen in isolation.
Yeah, that's true.
So you'll find that maybe someone is having financial pressures, relationship pressures, those contribute to their mental health.
Yeah.
So by virtue of that toll-free line where additional services are available, things to do with SRH, HIV, AIDS, GBV.
That's true.
So now someone can actually get additional help beyond the mental health that the mental health is just a symptom.
Yeah.
But now these other underlying conditions that resulted in the mental health issue can actually be sorted out by the team from one-to-one who are behind the toll lines.
Yeah.
Because even as we look at the data around the responses, you realize initially guys were calling out of curiosity to first find out the network.
Yes.
Then someone will probably throw a random question around relationships, around HIV. But then now you see mental health beginning to, the calls beginning to pile up. Now someone is ready to open up to address now that specific mental health issue that they were struggling with. That's why the platform has been an ideal platform to incorporate into the program.
Wow. That's good. And now even looking at, because we've gone directly to even just talk about the platform, what are views on digital health in general around mental health?
I think if I can start, I'll term it as 3 ways.
Okay.
One is accessibility, safety, privacy.
Oh.
Accessibility in that right now we're in a space whereby majority of the people, and even just the young people in this case, they have access to the smartphones,
Yeah.
laptops, and they're usually on their phone day in, day out. And therefore, if someone does not want to go to a health facility, they can always access this via their phone.
Yeah.
So that means it's basically just where they're seated, but they're able to be offered that support.
Yes.
In terms of safety, safety in terms of, because there's quite a lot of mental health stigma, you don't know how community members can react when they find out that you have gone to a physical health facility for what? Mental health. Exactly. So it's safe, it's safeguarding the youth, the community members, anyone who is using this, because it's your own personal sort of like secret in this case. If you want to share, you can share. If you don't want, it's okay. So at the end, it safeguards them, but it's also easily accessible for them. And still, it provides an avenue whereby if this person has been supported, they'll definitely ensure that the message is passed to another person. So they'll start to tell, oh, you see, one-to-one has supported me in this way and this way. Can you also maybe just look at it?
Yeah.
And that's how information is also just shared across. And it's not just shared based on what you see, but also based on how you have felt, how you've been supported even through that journey. And that's how I can categorize digital health in this case.
Okay. Wow, that's hard. Those are those answers where even if a lecturer was marking your paper angesema tu, we huyu na alikuwa class. Okay, what about you, Eugene?
Yeah, so just to add on to what Michelle has said, I think it's also on trend with times.
Yeah.
Because right now, a young person wants to order food, they just go to their phone. They want to buy clothes, they just get to their phone. So health services will actually be the same.
Yeah.
Because if someone has a device, especially if it's a platform where you can do both text and call, you're in a matatu on your way to work or to school, you can just have a chat with the get your whatever issue you're facing assisted. Yeah, so just it being on trend with the current times. That's why digital health is something that girls should actually be investing a lot more.
Yeah.
And it doesn't matter where you are, even mashinani. We were being told recently that pastoralists have smartphones.
Yes.
Because they were trying to figure out how do you get a message to someone in Isiolo mashinani that pastoralists have smartphone. How do they access news when they are with their cows?
Yes.
So imagine having a service that someone can access from anywhere at any time, whatever location. Yeah, so digital health is something that ideally it's the next progression of health services. Ideally should be digital.
Yeah. And I'm even glad you're pointing out the pastoralists, because even looking at the platform, the call center that we have, when you're talking about calls and SMS, there are services that are considered low-tech services, even in the tech field. So anyone, anywhere in Kenya can access the call center using an SMS or a call. Bora tu ako mali, ako kwa booster, ama the booster. They're not so far from the booster, because all service providers, talking about Safaricom or Airtel, they can be able to reach us.
Yeah.
So that's true. And I agree, like you're saying, as long as you have a phone, why not get a health service?
Yeah.
Yeah, we cannot be living as if we are not moving with the times. All right. Looking at you also, Eugene, you brought about the data. I don't know that Michelle, you've been able to interact with any data from the 3 months you've been doing this.
Eugene shared.
He shared. Okay, great. So what do you think? Rather than just look at that data, what speaks to you?
I think the first report that I saw, which was shared, the data was speaking to around, I think, over 50 who have either called or texted. And in this case, we're also looking at 3 settlements where we are doing the race to resilience. That is Mathare, Mukuru, and Kahawa Soweto. And for me, I categorize that as a plus and as a success. The fact that community members are not just sitting with their issues. They're starting to become more self-aware that they're facing this or they're going through this. And they need support. And they go to even an extra mile to even just call or text. For me, that's a success story, honestly, that over 50 people out of the 3 settlements have been able to just reach out. And I'm seeing a sense whereby for now, because this is something that we are starting even within the informal settlement, it's never there, let's be honest. It's never there, or if it's there, also you know how the services, the mental health services are usually quite expensive and not everyone can afford. And I'm seeing a situation whereby in as much as right now we're also looking at the numbers, right now there can be a spike in the numbers, even as we continue to raise awareness, sensitize the communities on the same. But in the next, even let's just say in the next 5 years and above, we can maybe start to see a decrease in the numbers. And for me, that again will be a success. So for now, the fact that people have started to also just text, call, it's a success. Even if we had even just one person or 2 persons, it's still a success on our end. And we are really, really proud of the people who have reached out.
Wow. What about you, Eugene?
And basically, these are numbers we are noting after a month or 2 of engagement. Because for us, if we can give a comparison with actual physical services, because we have programs where we do campaigns promoting physical access to facilities. We realize we'll run a campaign over a year, but the numbers would be probably 30 people were referred. People were referred. I think the highest we've gone was about 70 after around a 2-year period.
Wow.
So when you see 50 people actually seeking mental health services after just barely a few months of
campaigning,
and it's not even intensive awareness, they realize actually people want services. They just need it to be convenient to them. They need an element of anonymity, which the telehealth platform provides. So that will be a nice way to actually get more people seeking for services.
Oh, so we have ambassadors here, guys.
And I think maybe if I can just add, maybe a contributing factor to why we're also just seeing 50 have reached out and comparing to what Eugene has mentioned, I think it's the fact that we're also using the community members who are now the TOTs. So now they're the ones who are becoming the champions and they're the ones who are ensuring that they can still pass this knowledge to the community members. So again, we have some level of trust that is there. And I think one thing that we have realized over time is if you want an initiative to be successful in the settlement, use the community members themselves. And in this case, even the way now we have trained the TOTs, we have ensured that they have even that leadership role to support in this. They're the ones who are now ensuring that even these people are now reaching out. And I think that's also another success.
I agree. And even looking at our monthly meetings and all the feedback they will give, and we were trained because those young people are not silent. If there's an issue, and they speak out. And I'm glad, because that also falls under empowering young people, being able to champion for their health. So I agree. That could be a very good contributing factor to this success. All right. Looking at now, we are coming to a stop, a little, tuko mahali tumehold kidogo. Before even we move on to the next phase, what would you say are some of the challenges that we've experienced and we can improve on? Let's answer na Eugene sasa this time round.
I think a bulk of the challenges we addressed. There was initially the language barrier, where basically your system is typical language that guys are used to. But then you get an three informal settlements with different people having different slang. So we call it slang, not shan't. So you want people referring to mental health or being in distress in different ways. So we came across some really interesting terminologies. And actually happy how your system was very teachable in a very short period of time.
Yes.
Because there are a lot of people offering telehealth services, but it's the standard English,
Kiswahili. Yeah.
They're never really adaptive. So the way the system was adaptive to the situation, I think we addressed the biggest challenge.
Yes. Yeah.
So now moving forward, I believe the challenge would be now just financing sustainability of the service. Because of course the service does not come free of charge. Provide that service. And I think that will be the biggest challenge moving forward that can be addressed. But as long as we continue showing this value in having the platform available, then now we can use that as a way to pitch for more investment into the system.
Yes. I agree with you. Hapo umeguza Michelle.
I think one major challenge, but I'll speak from the community angle, is we are not able to reach those ones who don't have a smartphone, any type of phone in this case. And I'm giving an example of even Kahawa Soweto as an informal settlement. There are quite a lot of youths, and majority of them either face the drug addiction or just other issues that also require,
the support.
Exactly, the support in this case. But again, you'll find, even from the debrief sessions that you've been having, majority of the TOTs are mentioning how, what about this category of people who do not have the smartphones and the phones? And I think even when we are moving to the next phase, we can look at how we're able to support specifically the ones who do not have, because if you just say that they'll be able to even borrow a phone from a friend, if the one-to-one team also calls them and now it's the friend who has the phone, so what happens? Again, there is that issue of you're not even safeguarding them in this case. So I'm seeing an opportunity whereby this can be crafted, and we can see how we're able to address the ones who actually do not have phones, so that they're also now incorporated into the digital health in this case. All
right. The beauty of even one-to-one is we have a peer-to-peer model, and we can actually discuss more after on how to integrate that and ensure the ones who don't have phones, still have access to the service. All right. Lessons learned. What lessons have we learned? As you think, I could start. One of the great lessons I've picked from our partnership is the value of working together, all of us, from the champions to you as partners, to us as part of the call center team, and even, someone from one-to-one in general. So working together, for me, has made this a great success, as opposed to working alone or just being in meetings, virtual meetings na nivo. Bana tumekuja kwa ground, kuelewa, what's happening at the cafe sessions. And that has brought so much willingness to push and actually make this partnership a success for me. That's my greatest lesson.
I think for me is the co-designing bit. Just as Eugene has mentioned, even while we were co-designing with the youths, what are some of these terminologies that we want to be embedded even within the one-to-one system? I think that's a great success because, or a lesson learned, because you'll find even majority of the times, if you want to do an intervention, it's either you'll do it in your boardroom, then after hapo, ndo unaleta mayouth, unawaambia, sasa ndo hii hapa. But the fact that all of us, we were willing to learn from each other, and we had those sit downs, in as much as it took some time, we were really willing to now hear what are the youths saying, and even now for them, it's not only them, they were even going back to the community and asking and picking what are some of these terminologies that they are used. So in this case, you'll find that in as much as, yes, we are this as a team, but also there is a ripple effect even to the community members, and they are part of the co-designing phase in as much as we are not even seeing them there, but the TOTs are the ones who are now championing in this case. So for me, that is a great lesson, and a lesson that I think majority of the organizations, institutions should just champion for that co-designing from the start. Exactly. Yeah. So that again, it creates even the community ownership in this case. I don't think there is a moment whereby these TOTs have mentioned that this intervention is for basic needs, it's for SDI. They usually term it as their own.
Okay.
And that's a really, really great achievement.
Wow.
For me, I think it's been how patterns of human behavior are the same. Because I've got an opportunity to be around digital health programs, community programs. And the patterns I noticed were the same. For instance, in community programs, even for mental health services, you go set up a clinic somewhere. They want someone will come, they'll just sit on the bench the whole day. They won't do anything. They'll just watch how guys are going in, coming out. Day 2, they'll do the same. Day 3, someone will actually now come with, maybe it's their child or someone they were caring for with a mental health condition, to get treated because they needed time to become comfortable. It's the same way if you look at the trends in terms of initially when you were telling guys there's a toll-free line. Someone will just call, maybe listen for a few minutes, then go check the airtime, come amekato. Actually, no, is this thing for him? Yes. Then eventually now you see people actually calling to have the issues sorted. So it's just human patterns. And so whatever we are seeing in terms of the data, the trends from the call-ins and the issues being sorted is the same we usually see from the physical side of service provision. So for me, I think it's just been a lesson on I don't know if I should call it human psychology, and the importance of just structuring programs to adapt to human behavior, so that you don't give up. You set up a telehealth line and the first couple of calls ni watu tu wanasumbua. Someone will say, I'm just wasting money. But actually, if you're patient and let the system operate the way it's structured, you realize you end up knowing that you've actually put a solution that is valuable to the community. So I'm actually looking forward to a period when we'll be able to do this long term. And be able to do a research around it. Whether it's an option, it's an option that should be considered on a large scale.
Wow. Hey, you are deep. Okay. All right, yes. So now, honestly, I don't think I even have much to add because you've even just spoken about what you think as organizations we should do better. Because you've talking about how to even see whether we can research this and improve it on a national level. You've talked about how we need to ensure we are working with the community members when you're interacting with any intervention. So that's it on this discussion. Do you have any final words that you'd want to tell whoever's going to be seeing this?
I think first of all is to also appreciate the rest of our partners, including Billion Minds, Tabasamu Cafe, and also our funder, in this case, L'Oreal Foundation. And to also just appreciate everyone that has been on this journey. I know mental health, I categorize it as a sort of like a wound. And if you start it, you cannot close it in this case. So if you start an intervention on mental health, you still have to continuously just do it. And it's been something that we're also trying to see how we're able to now incorporate even within our programs in this case. And we're looking at also upscaling even to Mombasa, Kisumu. And if anyone is seeing this, you can always reach out even to our TOTs. I know at the end, there'll be another segment for them. And you can always reach out to them. You can reach out to the one-to-one team. You can reach out to us in case of any partnerships. We welcome them with open hands. Thank you.
All right. What about you, Eugene?
So for me, it's the youth-facing approach to programming. Because typically a lot of organizations say they're doing programs for young people. But you'll find it's a bunch of past millennials. So anyone past millennials should not call themselves young. It's a program for now Gen Zs moving downwards. So this program, even when you see the TOTs, guys in the community, it's basically young people engaging with each other. And when they come across challenges where they meet older people who need the service, they'll actually be honest and say, we need more older people to engage this older. Yeah, so just having programs that are youth-facing and co-designing them with youth, structuring them in a way that works for you, that's how you become successful. But I think we didn't mention this with Michelle. This was meant to be a pilot. But even as we were presenting findings to the funder, L'Oreal, like I think we've surpassed results for the pilot because we now have results that it's beyond proof of concept. Because you are just to prove a concept, they now get funding to implement. But now we are presenting the findings from this, and they're surprised as to how much has been achieved in barely 7 months. So it just goes to show how the program was well crafted for young people and how it's working. And so it's important to basically be youth facing. If you're doing a program for youth, just do it to address the needs in the way that they want the needs addressed.
Wow. So guys, we've had brilliant people with me on set, as they said, and honestly, I'm glad that you are able to join in and just give your words in relation to how our partnership has been. I've also enjoyed this partnership. As LVCT, we've enjoyed this partnership. And I can't wait to see what the future holds for us. That's it. Ciao.